Well, I've got my good friend, Dr. Danielle Nance, with me today. It is so great to see you. Thank you so much for joining us for Prophy Conference this weekend.
Hi, Jonathan. I'm so happy to be here. Thank you so much for inviting me. I'm glad to be here. I'm currently working as a hematologist in Arizona, in Gilbert, Arizona, at Banner MD Anderson Cancer Center, where I am building the first hemophilia treatment center in the Banner Health Network system. And that has been a big challenge, a lot of fun. And after we're done on this call, I have some more meetings with the administrators to help make that a reality. So it's been really great work, and I'm so excited to bring more healthcare to our families who need it.
Yeah.
I have a personal history with hemophilia. I was born with hemophilia myself and had my first joint bleed at the age of 2. And so I have had some struggles along the way figuring out how to cope with hemophilia and then have a healthcare system that's not really geared up to taking care of women with bleeding disorders. And then along the way, I was blessed with 2 children, and my youngest son does have severe hemophilia as well. So we have lots of experience with working out how to get prophylaxis right. And I'm grateful for the opportunity to share that with you folks today.
Well, it's amazing because you've had all the experiences, right? As a caregiver, as someone living with a bleeding disorder yourself, having to fight the uphill battle of getting even diagnosed yourself, even from having
Mhm.
your own clinical background. I know a lot of times so many people, I hear the stories over and over again, how there's so much frustration sometimes with where they feel like, I know something's wrong. I know that I need to get a diagnosis, but we're oftentimes looked at sometimes as lay people because we don't have maybe the degree or the information behind the educational standpoint. And here you are, you've got all the credentials and you've got your own experiences. And I know enough about your story to know even that was a little bit of an uphill battle for you too, right?
It does. It really is. And it takes a lot of science. It takes a lot of us working together with our physicians and being part of clinical trials and being willing to experiment and also get a lot of imaging. So, a lot of x rays, a lot of ultrasounds, a lot of CT scans to document that those pains are actually bleeds and that they really do need to be treated with factor. But I think today we're going to focus a little bit more on preventing nosebleeds and how we can work with our schedules and our bodies to get all of our intended prophylactic doses.
That's so true. And I'd love to know a little bit about your journey with that as far as you've of course been able to treat your own son for his whole life and then of course your own joint bleeds. Have you ever had joint damage of your own that you've had to deal with, that you've had to respond to, and were you always on prophylaxis? I guess maybe that's a good way to start too.
Oh, Jonathan, what a wonderful question. I actually was not on prophylaxis after um, until after both of my children were born. And while I did have bleeds, the older I got, the more bleeds I ended up having. So I have technically moderate hemophilia, about 4%, 2 to 4% consistently throughout my lifetime. And so I wasn't, there would be periods of time where I would go several years without having any bleeds. And I would wonder myself, do I really have a problem? But then, you go on vacation or you step wrong and boom, you've got another bleed. So because of that, I definitely have joint problems. I have right ankle, right hip, left knee, and both my forearms. Actually, I can't open jars anymore because I had so many untreated bleeds in my forearms as a younger person, and those just weren't life threatening. And so you just didn't treat bleeds unless they were life threatening, in the past. So when I was first able to have my own factor in the home, that was I think I was maybe 23. It was after I started volunteering with the National Hemophilia Foundation at my home chapter in Utah. And so learning to self infuse with those courageous young boys at camp, that was really, I mean, my inspiration. You see 7-year-old boys that can stick themselves, and I was determined to do it myself. But those boys and my brothers and my family members in the hemophilia, and now my many, many sisters, have really been that strength to help me in my curiosity to be a physician. And and even the hemophilia community has helped me get into medicine. So I really owe my success to my hemophilia community. So I'm so grateful now that I am in a position that I can help to give back in a meaningful way to to help others and to continue to gain strength myself.
That's so incredible. That's so incredible. Well, you're an inspiration to us all, really, and I just always appreciate your empathy that you exude in every time that I communicate with you about different things. But also, just I watch you as you've given presentations throughout the community in various circles, and you always just you've lived it. You don't just talk about it from a place of just research alone. You have walked it out, and it's evident in the way that you communicate with the community, and that is so appreciated. I mean, I can just tell you from the community point of view, I know for me as a patient, even, it is so the work that you do is so appreciated and valued. Now I have, I guess, maybe another question about the journey that you've been on. Have you ever experienced times, I mean, some of the people that are watching right now maybe feeling like they have, they're just tired of giving
Hmm.
themselves infusions. They get weary. I mean, I've been there. I've needed my support system. Sometimes my wife has to encourage me, even now. To say, that's my elbow. You got to keep doing the right thing. So how is it that you have? Have you ever had a time? I guess would be the best way to position that question. Is have you ever had a time where you felt like you were just tired of doing it, even though it was an option, even though it was prescribed, even though you had a regimen? Did you ever get weary of doing it yourself?
Oh gosh, Jonathan, there when I first had prophylaxis, it was just twice a week, and there was a question of, gosh, do I really need this factor? And then of course with having young kids around and my job, I mean it was really a lot of times it was really my husband who was like, Danielle, it's Thursday, you got to get your dose today, and he would pull it out of the fridge and help me set it up. And I'm kind of slumped in the corner going, oh, it's too hard. And I mean, I I think that it's, that's the other thing is like, especially when Isaac was little and I had to get up and leave for school, leave for work way earlier before they were getting up, and there was just no way my husband was going to get his infusion in the morning without my help. It was already a struggle. He did a lot of infusions, but it wasn't something that could be accomplished in the morning. And so, we did the prophylaxis at night for quite a few years. And I mean, I'm working in the hemophilia community, and I know that it's better to get it at night, or I'm sorry, to get it in the morning. I teach people that if they can do it in the morning, they should. And it just, it wasn't happening at our house. So we switched to the evening, and we did that for a few years. My son didn't get bleeds because we were at least consistent most nights to get that prophylaxis. And and it's really that consistency. So whether you're getting it in the morning before school or you're getting it in the evening, at least it's getting in there. It's sealing up the leaks in your blood vessels. And it's really protecting your body and protecting you from those severe bleeds. The more we know about hemophilia, the more we realize that every bleed matters, everyone, especially in a joint, because your joints are like elephants. They don't forget even one bleed. They are going to be reminding you, maybe not tomorrow, maybe not next week, but a few years down the road, you're going to have that ache and you're going to have that pain, and you're going to remember, I had that joint bleed, and gosh darn it, I can still feel it.
Yeah.
So every prophy dose really matters, and it really helps us to heal up and stay healthy and strong.
You bring up a great point about the fact that I love that every bleed matters. There's such a tendency sometimes, I think, especially and we work with a lot of young adults in the work that we do with helping people through transitions, right?
Mm,
And one of the things that I find is that a lot of times we've been on Prophy maybe my whole life. I start to move out on my own. I've got my own apartment. I'm having to manage my own care. And standing on your own 2 feet is a little bit of a challenge to feel like, that question that you go, you got healthy joints. Maybe you've been on Prophy your whole life
mhm.
and you've got good joints. One of the things that I think, and you and I have had some conversations about this in the past, where I think most people don't realize that even one bleed in a joint can actually cause enough damage to start a trend if you're not careful. It doesn't have to be 40 bleeds. It could really just be one or two really bad bleeds that could really trigger something negative in a joint that, like you said, it has a
Hard
memory.
to
You
come,
really can't
yeah, it's hard to
reverse it.
come back from. Yeah. And and that's part of why joints are so vulnerable too, because the blood vessels aren't actually supposed to be inside the joint. They're around that joint capsule. And when you get a bleed, it stretches out that joint capsule. So the architecture is never the same. It's like blowing up a balloon and then deflating it, and it's all wrinkly. Like it never goes back to its pre expanded way again. So even when the joint heals, it's been stretched out and it doesn't have the same strength anymore. The other thing is that blood, it brings calcium in there with it, and calcium is like sand, and it will actually kind of erode through very slowly that slippery, glistening, smooth cartilage layer, and that can take years. But again, that's why we want to keep the blood out of those joints, because they won't, they'll just be normal joints if they never have a bleed in them. But even a small bleed, we hope it heals completely, but it takes a long time. So, yeah, catching those bleeds as soon as possible, wrapping them up, resting them, which is, in my mind, the factor is the easy part. It's the rest of the joint. It's resting it, it's staying off of it for a couple of days, it's taking it easy. Now that's the hard part. The factor is easy. It helps, the pain is gone quickly, but it's really like taking your time and protecting that joint. It's going to be vulnerable to rebleeding for a whole 2 weeks. So, especially those of you who have mild hemophilia, or you're not used to prophylaxis, it's new for you. Recognizing that 2 weeks is the bare minimum for healing after a wound, especially a joint and a muscle bleed too. Muscles, again, are take a long time. Those muscle fibers have to stitch themselves back together, and that really takes some time. So protecting that area and going easy on your body. And it's just so hard to slow down because there's so many fun things to do all day long, or work. If you're a mother, or your father with young kids, slowing down is like impossible. Um,
Yeah, you're so right. And I talk about this too. Like, I mean, I know that you have a lot of insight when it comes to sort of the emotions that we go through. Even our own emotions can actually have an impact on inflammation, right?
there's definitely a mind body connection in everything we do, and I feel like when when you've got a bleed, and certainly a painful spot, that generates a lot of terror, quite frankly. And that's our deep brain, that's our deep emotions, that's helping to steer us into a safer environment. And it's very important that you're talking to either your clinical team or your friends and loved ones, and let them comfort you, because it's a really lonely place to be, to have hemophilia, especially if there's nobody else in your family that has it, and going through that deep pain. It's a joint bleed isn't a type of pain that you can move away from. You can't change position and have that bleed feel better. Um, the only thing you can do is be still and take your pain medication and wait for the pain to get better. And and it's hard, I think, sometimes for someone who's never experienced that, to really understand how deeply emotionally disturbing it is to be so worried about the health of your body. I think in that, I feel so blessed that I get to take care of patients and to be able to be part of their journey back to health, or maintaining their health. And recognizing that it's scary to have a bleed, even if you've had one before. I've seen grown men literally just freaking out because they had a bleed and they haven't had one for years, but just so terrified knowing that long road ahead of them for the recovery. So if you have access to a therapist to just talk about your feelings, then it's really important that we acknowledge that any bleed, whether it's big or small, it triggers that response in our body, that flight or flight response, and to just be aware that that is a healthy and normal response to a bleed. um, right now it's not a needed response because by and large we're safe and we have treatment, but it's still, we need to recognize it and respect it, and offer some comfort to it.
So good. I have to give you credit because I don't remember how long ago this was. It must have been, we had just met, and I think it was pretty early on. Maybe this may have been like 10 or 11 years ago. I might be
It
dating
was a
myself
while
there.
ago. Yeah.
But yeah, so we were in the hallway at some event somewhere, and I was still treating myself. I mean, I was definitely on prophylaxis, and I was definitely, but I was an adult before prophylaxis was recommended, number one, and number two, I'm a little thick-headed, so it took me a good, 4 or 5 years of my physician's preaching before I started to really,
Oh yeah.
respond and integrate into my life. But I was still sort of at this place where maybe I was infusing on one schedule, and I really should have been infusing on maybe a more regular schedule. And I remember we were walking through the hallway, and you said to me, I made some comment about how factor doesn't help with pain, and you very lovingly and gently, in the way that only you can do, encouraged me, and you said, actually it does, and I mean, it couldn't have been a more shocking revelation to me at the time, because I knew that factor was a part of the solution, but I was living in so much pain all the time
Mhm.
that for whatever reason, I didn't connect the dots that when I infused more, I could actually live in less pain, and pain medication wasn't the answer. Now,
Right.
thankfully, I haven't been on a lot of pain medication in my lifetime anyway. I've had to go on and off of it for surgeries and things like that, but
Sure.
I still was just living with it. I was living with this pain, and it really opened up my mind in a way that I could start to have some conversations with my medical team and start to really say, you know what, maybe something's wrong here. Maybe I need to really evaluate this. And that led to doing PK studies and finding out that I had a
Mhm.
short half-life and needing to make adjustments. And so I'd love to say that I've been perfect on my amazing schedule since then, but I haven't. But I really
Haven't.
have been so much better, because in my mind, I was able to connect these dots that said, you know what, while it's not a pain medication, it doesn't necessarily address the nerve endings. What it's doing is, though, it is helping you to resolve the problem that's causing you pain, and it really is something. But what you said earlier is so perfect. Consistency is everything. It's about
Yeah.
the regularity of your patterns more so than it is even sometimes, whether you're
You're
taking
getting it at the
lunch or
perfect
not.
time of day. Yeah,
Right.
exactly. Yeah, because when we get our factor regularly, then all those little tiny bleeds that start just from running around the planet, those little tears in our blood vessels that slowly, or a tiny bleed, and then they break open and become a big bleed, that doesn't happen because they continually reseal up when you get your next dose of prophy. So you're really preventing that leak into those weak areas in your body, and you're just keeping those blood vessels healthy and strong all the time. Yeah, that's exactly right, and that's the point of prophylaxis. It's to keep your blood vessels that get torn up during your movement on planet Earth, to keep them healthy and strong. Yeah.
That's
So
so
that's
good. Well,
exactly right. Thank you for reminding me of that.
yeah, well, and it's so true, because again, we often say sometimes our biggest problem is right between our two ears. For me, that was something that was
Mhm.
really life changing. And again, I had been on Prophy for some time, but just having to think about it from a different way. That's why we love having moments like this weekend to be able to talk about this, because the truth is we all go through ups and downs. And I do believe that our mental state sometimes has a bigger impact on, the behavior of how we actually, you know, continue to be consistent. And
That's right.
and that's really difficult sometimes.
Yeah, and I will say, it's, in those, uh, so working that hard, getting all of those infusions, that is such an expression of self-love, and it's so much, you know, um, protecting your health and staying on track, and helping each other, encouraging each other in that journey of self-love, and knowing that, as we protect ourselves and we're able to make the world a better place.
It's so true. And I think, we would be remiss if we didn't talk a little bit about, um, did I lose you, Danielle? Can you hear me? I think I might have lost you.
Every
Can,
dose matters.
can you hear me now?
I think we had a
Oh,
little interruption, but we're
that's
back.
all right. I think it cut out for a
Yeah,
minute, so I don't know, but that's okay. We can edit that part out. Are you
that's
okay
fine.
now? Yeah, it seems like it's connected
Yeah,
now.
yeah, good. Yeah.
Yeah. I want to address one last thing before we go, and I think that's
Hmm.
really, really important is, for maybe some moms out there that are feeling like something is wrong, they're suspicious maybe of that. Maybe they should be on prophylactic treatment. Maybe there's something wrong that they need to get. Maybe it's even they need to get diagnosed, and they're having trouble getting there. They're having trouble. They don't know who to talk to. They don't know where to go. Everybody kind of maybe has brushed them off when they brought it up. Is there anything that you would encourage some of those women to
Hmm.
really push through and have the fortitude to really just continue to seek answers, even though they've had a difficult time?
Yeah, that's a really great question. Of course, I want to see every mother who has hemophilia be tested and diagnosed. And as we're learning more and more about how hemophilia affects women, one thing that we need is data. So we need that women who suspect they have a bleed to get their primary care doctor to order a CT scan or an ultrasound and get in promptly and get that done. If there's blood in that joint and the factor level is less than 50 or 60%, then that woman might need factor when she has joint injuries. And I did want to just bring up that there's more than one kind of prophylaxis. So if you have severe hemophilia or moderate hemophilia and regular bleeding, then, well, if you have severe or moderate hemophilia, you just probably need to be on prophylaxis, and you need to adjust your schedule based on how you bleed and your factor levels, how long factor lasts in your body. If you have mild hemophilia, though, there is another type of prophylaxis that's called on-demand prophylaxis, and that means you're going to the mountains or you're going out to the country for a weekend, and you are going to be far away from medical care, doing things that are outside of your normal range. You really may want to think about taking a dose of factor with you or taking it before you go. If you know you're gonna be traveling, especially if you're going long distances, and you want to minimize that chance that you're going to pull a muscle, haul in those heavy bags or whatever it is, a dose of factor before you go to the airport or get on that plane. It's a really good idea. So I like to call that aggressive prevention or aggressive prophylaxis, because again, when you know you're going to be in a vulnerable situation, why not have that extra protection? And we want to prevent every possible bleed. So once you know you have low factor levels and you are in a risky situation, you know your body better than anybody. So you can help teach your providers. I have a woman who is whose factor level is 20%, and she She's been through physical therapy. She is doing physical therapy, but her knee had a bleed in it a long time ago. So she actually does prophylaxis twice a week, and she has a great function of her knee, and she can continue to exercise. Whereas before, that knee pain just prevented her from staying active. And even, even if she's not going to the gym or going on a walk, she wasn't able to do her work comfortably and consistently because that knee pain was interfering with her job. So, there are a lot of opportunities for us to prevent those bleeds with different types of prophylaxis.
That's so good and so important. I'm hearing more and more stories of people with mild. Matter of fact, this weekend we have several people that are mild that are speaking at different opportunities throughout the weekend that are discussing this about having gone from having really no treatment to starting to get into a preventative regimen. And I am so encouraged to hear that people are able to start really thinking that way, and even providers are starting to think that way, because it is something that, like you said, again, we need to make every effort to prevent every bleed. And I think that that's so valuable. So thank you so much for all you do for the community, and thank you for being with us this weekend and being a part of Prophy Conference. We really just appreciate all the work you do and appreciate your time with us today, Danielle.
Thank you so much, Jonathan. Again, thank you for organizing this wonderful event and inviting me to be a part of it. I'm so grateful to be part of your team and to help you do the great work that you do every day.
Well, we treasure it so much, and I have to say, just talking to you again reminds me how much I didn't know I wanted to move to Arizona. So maybe I could talk my wife into it, but I
It's
do
so
appreciate
nice.
your
Yeah.
time. Can you just be like on call, like globally? Can you just like fly? Maybe we could raise money to get you a jet or something, and you could do house calls. I don't know. That would.
I did think about that for a while. And with the days of Zoom, it's almost possible. Uh, I would
That's
definitely
great.
need a couple partners, though. There's
That's
a
right.
lot of us out there.
Well, we wish you all the best, and I hope everything goes great. And we look forward to seeing you next time. But thanks again for being with us this weekend.
Thanks so much, Jonathan. Have a great time.
Thank you. Bye.